I'm Jeana. I'm going to be your nurse today, and I'm going to be doing a physical assessment. Do you agree to be videotaped and have me submit it to Olivet?
Yes.
Okay. I'm going to wash my hands first. Alright. So we did your vitals and everything before. So she's 5'3", weighs 120. Her BMI is 21.3. Temperature was 98. Pulse was 78. Respirations were 16. And blood pressure was 111/68. So we look at the overall appearance, looking for nutritional status, just looking at the overall health. I'm going to start with your head, so I'm going to feel for any masses, looking for any deformities, looking at the symmetry of your face. When I look at your face, I'm looking for your facial strength and your facial muscles. So I'm going to do a few tests. I'm going to test cranial nerve number 5, which is facial sensation and jaw strength. So if you can close your eyes and tell me if you feel sharp or dull.
Sharp.
Okay, and then this side, dull. Good. Okay, and then you can look at me. So to test your jaw strength, I'm going to have you open up your mouth and then kind of clench your teeth and move them side to side. Yeah, good. Okay, and then for facial, looking at your facial strength and looking at your facial movements, I'm going to have you smile and then frown, move your eyebrows up and down. Good. And that was cranial nerve 7. Then I'm also checking your hair. I'm looking for just the overall quality of your hair, looking for any bumps on your head and your scalp, looking for any dandruff, looking for equal hair distribution. And then I'm going to check out your eyes, so if you can take off your glasses for a second. Okay. Looking at the symmetry of the eyes, placement. I'm going to check cranial nerve 2 and 3, checks for pupil reaction, so if you can just look straight at me. Good. Good. And then I'm going to test extraocular movements, so if you can follow my finger, keep your head still, but follow my finger with your eyes. And then follow my finger in. And that was testing cranial nerves 3, 4, and 6. And you can go ahead and put your glasses back on. And I'm going to test visual acuity, so I'm just going to have you cover one of your eyes and tell me how many fingers I'm holding up. 3. Okay, and cover your other eye. How many fingers am I holding up? 5. Good. And I could also test visual acuity by with an ophthalmoscope by looking at your ocular fundi and looking at the ocular vessels. Also, I'm going to look at your nose. Looking for symmetry of your nose. I'm going to look at the septum and looking at the mucosa. Looking for any drainage, any redness, any abnormalities there. And then I'm also going to look at your ears, looking at the placement of them, looking for symmetry. I'm going to test cranial nerve number 8, which is hearing. You can hear normal sounds because you're responding appropriately, but I'm also going to test by whispering. So if you can cover one of your ears, and I'm going to whisper a word and you repeat it, okay?
Okay. Mother.
Okay, cover your other ear.
Apple.
Yep. And then I'm going to go ahead and look inside your ears. Okay. Alright, I'm looking for the tympanic membrane. I'm looking for the light reflex. Looking at the color. Seeing if there's any drainage, pus, redness, anything like that. I'm going to check this side as well. I'm looking for the same thing over here. And it's nice and gray on both sides. Okay. I'm also going to assess your mouth. Looking at the color of your lips, hydration. And then if you can go ah. Okay. Looking at your tonsils, looking at your teeth and your gums, looking for cavities, any lesions or anything like that. I'm also going to test cranial nerves 9, 10, and 12. So if you can swallow for me. Okay. And then go testing your gag reflex. Okay. And then just stick out your tongue. And I'm looking at the placement and symmetry of your tongue. Okay. And then I'm going to assess your neck. So I'm just feeling your neck. Any pain or tenderness?
Nope.
Okay. I'm going to feel for your thyroid. Good. Alright, and then I'm going to feel your lymph nodes. I'm going to start with the anterior and posterior cervical. So this is anterior, posterior, submandibular, submental. Occipital is back here. Okay. Supraclavicular. Okay. And then I would assess inguinal as well, but that's deferred for this video. So I'm going to start with your back now. You can maybe turn just a little bit. Okay. So I'm assessing the color of your skin. I'm looking for any lesions, looking for any redness, edema, any moles, anything like that. So I'm going to go ahead and pull your shirt up just a little bit, okay?
Okay.
So you can see your back. Okay, good. And then I'm looking also for any respiratory distress, any retractions, anything like that. And then I'm going to test for equal lung expansion. So if you can go ahead and take a deep breath. Good. Okay. And then I'm going to feel for tactile fremitus. So when you feel my hand on your back, say 99.
99, 99, 99, 99, 99, 99.
Good. And then I'm going to percuss over the lung fields as well. Okay. And then I'm going to listen to your lungs. So if you can take a nice deep breath when I place the stethoscope on you. Good. Now I'm gonna test egophony. So when you feel the stethoscope on your back, if you can say E.
E, 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 E.
Okay. And then the same with bronchophony, if you can say 99.
99, 99, 99, 99, 99, 99.
And then whisper pectorally, if you can whisper 99. Good. Okay, you can turn back around this way. I'm going to assess the front. Okay, so again, I'm looking at your skin, looking at the overall texture and color and temperature of your skin. I'm going to go ahead and also look for respiratory distress, looking for any deformities, any abnormalities, looking for symmetry. I'm going to go ahead and do equal chest expansion again, so if you can take a deep breath. Good. And then I'm going to do tactile fremitus again, so say 99.
99, 99, 99, 99, 99.
Okay. And then I'm go ahead and listen to your lungs again. Good. Okay. And then moving on to your heart, I'm going to palpate your carotid. You can just look that way. Feeling your pulse. now I'm going to listen to it for any bruise. And I'm going to listen to your heart sounds. Okay. It's aortic. Pulmonic. Herbs point. Tricuspid. And mitral. I'll listen with the valve as well. Now listen to your heart rate for a minute, okay? Good. It was 80 and nice and regular and strong. Also, the point of maximum intensity, I'm going to palpate that and feel your pulse there. Good. You can feel it nice and strong. Okay. I'm going to have you lay back, if you don't mind. I'm assessing for any heaves or lifts. I'm going to palpate each point of the heart to feel the pulse and feeling for any thrills. Okay. So pulmonic or aortic. Pulmonic. Herbs point. Tricuspid. And mitral. Okay. And go ahead and listen to your heart again. Okay. Good. And then I'm also assessing for jugular vein distension. I'm looking to see if I can see the jugular pulsation. Just right by your clavicle. Okay. Next, I'm going to move on to your abdomen. So do you mind if I pull your shirt up? No, it's fine. Okay. Alright. And assessing, looking at the skin, looking at the contours of your abdomen, looking at the umbilicus, looking for any abnormalities, scars, rashes, anything like that. I'm going to go ahead and listen to the aorta. Listen for the renal arteries. Iliac. And then the femoral as well. Okay. And then I'm also going to listen in each quadrant for your vowel sounds. I'm going to go ahead and percuss as well. Okay. And I'm going to light palpate, feeling for any pain, tenderness. Does it hurt at all when I touch? No. Okay. Any masses or anything like that. And then do a little bit deeper palpation. And then any masses, feeling for the organs. Can you take a deep breath in? Feeling for the liver, if I can feel the water, go ahead and breathe out. And then also the same with the spleen. Take a deep breath in and out. Good. Feeling for the spleen and then for the liver. Good. And then can I have you sit up? And I'm feeling for CVA tenderness, so let me know if you feel any pain. Anything there?
No.
Okay. Alright. You can go ahead and come around. And I'm going to assess your upper extremities. So I start off with your hands, looking for any redness, looking at your joints for any swelling, deformities, anything like that. Come out. Feeling for capillary refill. Good. I'm going to feel your radial pulse. Equal and strong. Okay. I'm going to have you do some range of motion with your fingers. So if you can, flex them and then extend them, and then abduct them away, and then adduct them together. Good. And then for your thumb, show thumb opposition, turn it in like that. Good. Okay. And then finger strength, if you can grasp, squeeze my fingers. Good. All right. And then just looking at the overall warmth of your upper extremity, looking for any edema, any abnormalities or anything like that. I'm going to look at your wrists next. So feeling your wrists, your joints, feeling for any pain or tenderness, anything like that. I'm going to test range of motion, so if you can flex your hands down, extend them up, rotate them around, radial deviation, and then ulnar deviation. Good. And then moving up to your elbows. So I'm feeling your elbow joints, any pain or anything there, looking for any swelling, deformities. And we're going to do range of motion with your shoulders, so if you can flex your arm up, your elbows, flex your arm up and extend your arm out, And then I'm going to test strength, so if you can try to flex up against my, and then extend down again. Good. Okay, now I'm looking at your shoulders, looking at your joints, for any pain, swelling, redness, anything there. Range of motion for your shoulders, if you can flex them up and extend them, and then if you can circumduction, I know it's kind of hard to sit down, if you can twist them around, good. If you can abduct them away and adduct them to your body, and then internal rotation and external rotation, and then if you can touch the back, your back, and like try to touch your back, and then with each side, good. Okay, and then for your shoulder strength, if you can abduct your arm away, and then adduct it to your body, good. and then abduct it away, and abduct it to your body. Good. Alright, I'm gonna have you close your eyes. I'm gonna do light touch sensation, so just tell me yes whenever you feel me touch.
Okay. Yes. 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 Yes.
Good. Okay. I'm going to test stereognosis, so I'm going to have you close your eyes, and I'm going to put something in your hand, and you can feel around for it and tell me what it is.
A coin.
Yep. And then your other hand.
A safety pin.
Okay. And then keep your eyes closed, and I'm going to test graphesthesia, so I'm going to write a number in your hand and tell me what it is.
2. 7.
Yeah.
2. 3. 5.
Yeah. Okay, you're going to open up your eyes. I would test vibratory sensation, hit my tuning fork and place it on the ulnar prominence, and test, see if you could feel the vibration, and then let me know when it stops.
Okay.
Okay. I'm going to do range of DTRs on you, so deep tendon reflexes. So just try to relax as much as you can. Test brachioradialis. Biceps, just relax. Okay. Triceps. Again, just let your arm fall on my hand. Good. Okay. Over here, same. Good. Just relax, let your arm rest on my hand. Okay, and if you can, this is kind of low, so if you can, cross your leg. I'll do your patellar. Okay. And then let me test this one. Oh, I cross
Cross
it.
it.
Yep. Okay. And then relax your foot. Okay. And I should have done some there. Let me turn this one. Just relax your foot. Okay. Alright. So I'm going to assess your lower extremities, so I'm going to start with your toes. Looking for any redness, swelling, pain in your joints there. Okay. If you can extend, and maybe scoot back a little bit more, that might be better. If you can flex your toes, squeeze them up, and extend them out, and spread them apart, abduct them, and then put them together, adduct them. Yep. Good. Test capillary refill of your toes. I'm going to feel your dorsalis pedis pulse. Good. And then your posterior tibial pulse. Okay. Good. Feeling the overall warmth of your legs, looking for any edema, swelling, redness, looking at the skin, everything like that. I'm going to test your ankles. So feeling your ankles for any redness, swelling, or deformities. We're going to do ankle range of motion. So if you can plantar, flex your feet down, dorsiflex them up, rotate them around. Good. Inversion, put your heel kind of in, and then like push your heels out. Yeah, good. And then test your strength. So if you can dorsiflex up, good, and plantar flex down, good. And then I'm looking at your knees, your knee joints, feeling for any swelling, looking for redness, anything there. And then test your knee strength. So if you can push your legs out and pull them back in, good. And then for your hips, I'm going to test your hip strength. So if you can lift your leg up, good, and then push it down, good. And this one, lift it up and push it down, good. Okay, I'm going to have you stand up now. Okay. All right. So I'm going to feel your hip joints now. Good. Good. Okay. We're going to do hip range of motion. So if you can flex out, stand back. You can do it with both legs. Yeah. Do internal rotation and external rotation of your knees. Good. And then abduct it away and abduct it to your body with both legs. Good. Okay. I'm gonna also do your knees, sorry. Flex your knee and then extend it out. Yeah. Good. Okay. And then I'm looking at your spine. Looking at the overall curvature of your back, looking for any abnormalities, deformities, looking for symmetry. I'm going to do spine range of motion, so if you can flex forward and then extend back, and then if you can rotate to one side and then rotate to the other side, and then do bending, so bend to one side and bend to the other side. Good. And then if you can bend back forward, I'm just going to assess your back, palpate it for any scoliosis, any abnormality of the spine. Good. You can stand back up. Okay. I'm going to test for Romberg. So if you can put your arms out and close your eyes. I'm looking for any swaying, looking for any abnormal swaying or movement. You can go ahead and open them. I'm going to have you come back here just a minute. Okay. I'm going to have you walk regularly that way, assessing your gait. Good, you can stop. And then when you turn around, when you come back, walk heel to toe. So assessing tandem gait. Good. And then if you can hop on one foot, and then the other foot. Good. All right. You can go ahead and have a seat. Okay. Assessing the neurological system. Just assessing your overall level of alertness, which you're alert and awake, your appropriateness to responses. I'm going to ask a few questions to see if you're oriented. What year is it?
2016.
And what city are we in?
Bourbon.
Okay. And then for the cranial nerves that I didn't assess yet was cranial nerve number 1, which is olfactory. So I'm going to have you close your eyes and plug one side of your nose.
Mint.
Yep. And then I'm going to have you close. Yep.
Orange.
And then the last cranial nerve, the cranial nerve number 11, which is the spinal accessories. So I'm going to have you shrug your shoulders up against me, pushing down. So, good. And then try to push my hand away with your head. Good. All right, and that is the end of my assessment. Thank you.